Hey everyone, and welcome back to Breaking Down Nursing. Today we're going to focus on heparin drip calculations. Our first question, a 70 kilo patient is started on a heparin drip for a deep vein thrombosis, or DVT. The protocol orders an initial infusion rate of 12 units per kilogram per hour. The heparin supplied as a 25,000 units and 500 mLs of D5W. Calculate the initial infusion rate in mLs per hour. Now, as we went back and mentioned earlier, the first thing to always do is underline the keywords that are needed. Get rid of the fluff and the extra. So things we'd like to underline for this question: 12 units per kilogram per hour, 25,000 units, 500 mLs of D5W, and then what we're looking for, which is mLs per hour. So step one, we're going to calculate the total units per hour. So first we're going to write out what we're looking for, which is units per hour. So we're going to find units on top. And we know from the question at hand and the things we underlined above, we have 12 units per kilogram per hour. We're looking at the end for units per hour. If we put the 12 units per kilogram per hour, we need to cancel out our kilos. We know the patient's weight is 70 kilos. So our next kilograms would be on top. We cancel the kilograms out, and we're left with units per hour. So our final answer for this is 840 units per hour. But we're not done because we're still looking for mLs per hour. So we have to do a second step. Step two, let's convert the mLs per hour using the concentration. So now we're looking for our final answer of mLs per hour. We know that the bag has 500 mLs with 25,000 units. So we'll multiply that by the units per hour we got, canceling out our units, and we'll be left with mLs per hour. So add the 840 units per hour, cancel out our units, left with mLs per hour. So our final answer for this question is 16.8 mLs per hour. Okay, let's go on to the next one. After 6 hours of heparin therapy, we draw the PTT level and shows that it's 45 seconds, which is below the therapeutic range of 60 to 80 seconds of what we're aiming for. Per the protocol at hand, we're going to increase the infusion rate by 3 units per kilogram per hour. The heparin supplied at 25,000 units and 500 mLs of D5W calculates the new infusion rate at mLs per hour. So we're going to calculate the new rate. Our original rate from the last problem is going to be 12 units per kilogram per hour because that's what we started with. And now we want to increase it by 3 units per kilogram per hour. So 12 plus 3 equals our 15 units per kilogram per hour. Now we need to calculate the new infusion rate in mLs per hour. We're going to put our mLs per hour first. We're going to start with our concentration of 500 mLs, putting mLs on top over 25,000 units. Then we're going to want to cancel out the units. So we're going to put the 15, our new rate, units per kilogram per hour. But we're still left now, even when we cancel out the units, with mLs per kilogram per hour, and we're just looking for mLs per hour. So we need to cancel our kilos. Well, remember the patient's weight 70 kilograms from the first question. So we're going to plug that in. And after canceling out our kilograms, we're left with mLs per hour. After calculating, that our final answer is 21 mLs per hour. So I hope you enjoyed watching this micro learning on heparin drip calculations. Thank you for watching. As always, hit the subscribe button if you'd like to see future videos. And of course, if there's anything you'd like to see in the future, make sure to add it in the comments. Until next time.